Good day and salam sejahtera to everyone. My name is FARAH SAPUAN and together with my partner NAJMINA KAMAROZAMAN. Today we are honored to present a case study on a landmark achievement in Malaysian digital history, a national digital health platform that not only played a critical role during the COVID-19 pandemic but also marked a major step forward in Malaysian journeys toward digital governance and smart healthcare, which is MySejahtera. Before we begin, let me ask you a simple question. How do you track a virus that cannot be seen, spread silently, and move faster than a traditional system can respond? This is what ASEAN Malaysia faced in 2020. When we talk about a digital transformation, many people think it's just building an application, but it's not. As we have learned in this subject, digital transformation is not just an application, but it's a true transformation involving mindset, changing process, and service delivery models. As a response, MySejahtera was launched in April 2020 by the Ministry of Health Malaysia, started as a crisis response tool. Initially, its primary purpose was to support contact tracing to manage the spread of the virus, vaccination records to facilitate the national immunization program, and national health management to empower citizens to monitor their own status during the COVID-19 pandemic. However, as we will see throughout this presentation, MySejahtera has evolved far beyond the temporary pandemic tool. It has become a core digital health infrastructure supporting Malaysian long-term healthcare system. To begin, let us look at the external environment through a process known as horizon scanning. Firstly, health global crisis. The sudden outbreak of COVID-19 created an urgent need for real-time contact tracing. Traditional methods such as phone calls and manual records were simply too slow. In this pandemic situation, we know delay costs life. Next is the technological shift. Malaysia has a smartphone penetration rate over 19%, making a mobile-first solution is the most realistic and effective strategy. Instead of building a new system, government leveraged what citizens already had, which is their smartphone. Furthermore, regulatory pressure played a key role. Government SOPs required every premise to record attendance for monitoring purpose. Without a standardized system, enforcement would have been inconsistent and inefficient. MySejahtera provides a single national platform for check-ins across all sectors like shopping mall, office, school, and public area. Moreover, we enter a data-driven era. This horizon clearly showed that paper-based systems were no longer sustainable. Manual logbooks were prone to the fake information, missing data, and the human error. The future of governance lies in the big data and digital intelligence, and MySejahtera Malaysia was tapped into that future. Next, let's discuss why this particular work process was selected during this analysis. Firstly, it's critically. MySejahtera is a mission-critical system. It was not introduced as a luxury or optional digital upgrade. Instead, it was a national digital survival tool during the COVID-19 pandemic. Secondly, it's a complexity. Managing the health status and movement of over 32 million people is one of the most complex work processes in the country. It requires real-time coordination between citizens, healthcare providers, and government agencies. Finally, its visibility and relevance. As a case study, MySejahtera provides a clear evidence of how governments, agencies manage a massive-scale digital transformation under crisis conditions that can making it highly suitable for academic analysis. Moving on, I will now explain the rationale behind this implementing work process. Firstly, speed of action. The objective was to reduce the contact tracing window from days to minutes. With MySejahtera, once a positive case is identified, their close contact can be traced immediately through the app. Secondly, data integrity. The system aimed to ensure one vision of the truth. Manual records were often inaccurate due to their fake names, unreadable handwriting, or incomplete details. With this digital authentication, it can solve all of these issues. Furthermore, resource optimization was achieved by automating check-ins and health declarations. Thousands of MOH staff could be reassigned from the paperwork to frontline medical services. In addition, dynamic response became possible. MySejahtera enabled real-time hotspot identification using heat maps, which is impossible to achieve using the paper-based records. As the system matured, MySejahtera expanded into a comprehensive digital health platform. Firstly, personal health records. Users can access clinical data, lab results, medical summaries to supporting the vision of one person, one record. Next, the National Immunization Module. This includes digital records for COVID-19, BCG, MMR, hepatitis B, and other vaccination. Furthermore, the appointment system. Users can book appointments for clinics, dental service, and national health screenings directly through the app. In addition, donor modules were introduced. These include a digital blood donor card and organ donor pledging system. Moreover, mental health support through NAJMINA. These self-screening tools allow users to access their stress and anxiety levels. The infection disease tracker provides a real-time heat maps for COVID-19, rabies, and dengue. Finally, the Haji Health Card, introduced in 2025, provides specialized digital record for pilgrims.
Assalamualaikum, my name is NAJMINA binti KAMAROZAMAN. I will explain the internet audit of MySejahtera under the Ministry of Health. To begin with, we will look at the system and work processes that are currently implemented in MySejahtera. The platform functions as a centralized digital health system that integrates multiple public health services into one application. These include user registration, where citizens create personal health profiles, and then vaccination and immunization tracking, which records vaccination history. Other than that, health risk assessment, where user reports symptoms or health conditions. Next is appointment scheduling for clinics and vaccinations, and digital health records management. In addition to that, MySejahtera also plays an important role in public health communication. It sends notifications such as health reminders, outbreak alerts, and preventive health message. From an organizational perspective, this integration allows the Ministry of Health to standardize data collection, reduce duplication of records, and ensure consistency across healthcare facilities. Overall, these work processes help MOH manage health information more systematically and efficiently at a national level. Next, in terms of skill sets available, MySejahtera relies on a combination of technical, analytical, and healthcare expertise. IT professionals are responsible for system development, system upgrades, maintenance, and cybersecurity protection. Their role is critical to ensure system stability and protect sensitive health data. Next is data analysts, analyze large volumes of health data to identify trends, patterns, and potential risks. This information supports evidence-based decision-making at the ministry level. At the same time, public health officers and medical experts ensure that the system aligns with national health policies and clinical guidelines. Digital communication specialists manage user engagement, notifications, and public awareness campaigns. The collaboration of this skill set ensures that MySejahtera is not only technically functional but also medically accurate and user-oriented. Moving on to what is working well, MySejahtera has demonstrated high adoption and acceptance among the Malaysian population. Most users actively use the platform to check their health records, receive reminders, and access health-related information. The automation of processes such as appointment reminders and digital record keeping has significantly reduced administrative workload for healthcare workers. This allows healthcare professionals to focus more on patient care rather than paperwork. Furthermore, real-time data collection enables the Ministry of Health to monitor population health trends efficiently. This improves responsiveness during health emergencies and support better planning and resource allocation. These trends show that MySejahtera effectively supports MOH operational objective. However, there are still areas that can be improved. One key issue is system performance during peak usage, where users may experience low response times or temporary system disruptions. Another challenge relates to user experience, especially for elderly users or individuals with low digital literacy who may find the interface difficult to navigate. Additionally, users in rural or remote areas may face access issues due to unstable internet connectivity. These challenges indicate that while the system is functional, improvement in system scalability, interface design, and accessibility are necessary to ensure inclusivity. Addressing these areas will improve overall user satisfaction and system reliability. Finally, MySejahtera is managed by the Ministry of Health Malaysia, which serves as the main responsible party for the platform by providing overall policy direction, system governance, and national public health management. The ministry ensures that MySejahtera aligns with national healthcare objective and function as a reliable digital tool to support health monitoring, service delivery, and informed decision-making at a nationwide level. In carrying out this responsibility, the Ministry of Health oversees how the system is used within the healthcare ecosystem and ensures that the information collected supports public health planning and management. Alongside the ministry, the MySejahtera development team plays a crucial supporting role by being responsible for system development, continuous maintenance, technical upgrades, and system support. This development team ensures that the platform remains stable, secure, and capable of handling large volume of users and health data, which is essential for a national-scale digital health system. Their ongoing work allows MySejahtera to remain functional, updated, and responsive to changing healthcare needs. In terms of number of persons involved, the operations of MySejahtera requires the involvement of hundreds of personnel from both the Ministry of Health and the MySejahtera development team. These personnel are involved at different levels of operation, including system management, data handling, coordination, and technical support to ensure smooth nationwide implementation. The large number of individuals involved reflect the scale, complexity, and importance of MySejahtera as a key digital platform supporting Malaysia's public healthcare system, highlighting how coordinated efforts between policy oversight and technical execution are necessary to sustain its effectiveness.
Now that we have discussed the capabilities and features in MySejahtera, let us move to the next important section, which is new model generation. Essentially, the evolution of MySejahtera represents the shift in the national healthcare model. First, it marks a transition from reactive approach to proactive approach. Previously, healthcare system mainly reacted after people fell sick. However, with MySejahtera, the focus shifts towards early detection, prevention, and long-term wellness management. For example, instead of only record hospital visit, the system can continuously monitor trends such as rising chronic disease or mental health risks within the population. Next, MySejahtera leverage Malaysian high digital maturity. With more than 25 million users registered, the platform already has the widespread adoption and public trust. This allows MySejahtera to evolve into a national health super app, integrating multiple healthcare services into a single digital ecosystem. Furthermore, this led to the introduction of the Healthcare as a Service model, or HAAS. Under this model, healthcare is no longer limited to the clinics and hospitals. Instead, services such as a consultation, prescription, monitoring, and follow-ups can be delivered anytime, anywhere. Finally, this new model enables data-driven decision-making. By analyzing aggregate and anonymized health data, the government can identify the health trends, allocate resources efficiently, and designs preventive policies before issues escalate into a national crisis. In short, MySejahtera is no longer just a system, it is becoming a strategic national health intelligence platform. Having discussed the new healthcare model, the next section focuses on our recommendation improvement to further enhance the current system MySejahtera workflow. Firstly, we recommended the implementation of AI-powered predictive health analytics. By leveraging artificial intelligence, MySejahtera can generate individual health risk scores through the analysis of users' medical history, life cycle patterns, and clinical records. For example, the system can predict early risk chronic conditions such as diabetes, hypertension, or heart disease, allowing preventive action to be taken earlier. Furthermore, personal preventive alerts can be sent to users, including diet recommendations, exercise reminders, and timely medical checkup based on their health profile. At the national level, AI can also detect the system cluster, such as sudden fever increase in a particular district, enabling authorities to respond in real time and prevent outbreaks like dengue or influenza before they escalate. Next, we propose the expansion of virtual clinic and smart pharmacy services. Through Telemedicine 2.0, users can access integrated HD video consultation for non-emergency follow-ups, reducing unnecessary hospital visits. In addition, doctor can issue digital prescriptions, which are securely stored and verified within the MySejahtera system. This prescription can then be processed by the partner pharmacies, and with collaboration involving logistic providers such as CRABS and Post Malaysia, medications can be delivered directly to the patient's home. This improvement significantly can reduce hospital congestion, waiting time, and travel costs, especially for elderly patients or those with chronic illnesses. Lastly, we recommended the integration of Internet of Things IoT devices and wearable technology into MySejahtera. The application can seamlessly sync with platforms like Apple Health or Google Fit to monitor vital signs such as heart rate, sleep pattern, and physical activities. Moreover, an emergency SOS feature can be automatically triggered if irregular heart rhythms or faults are detected, particularly for elderly users. Additionally, high-risk patients can wait at home while doctors remotely monitor their health through a centralized dashboard, improving patient safety while reducing unnecessary hospital admission. In summary, this improvement transformed from MySejahtera from a monitoring process system into a proactive, intelligent, and patient-centric digital health platform. After discussing the system improvement, we will now analyze MySejahtera using the business model canvas framework. Firstly, the key partner include the Ministry of Health, private hospital and clinics, technology developers, insurance providers, and pharmaceutical companies. This partnership ensures the system sustainability, innovation, and nationwide coverage. Next, the key activities involve health data analytics, appointment scheduling, disease surveillance, digital vaccination management, and telemedicine services. These activities support MySejahtera roles as a comprehensive healthcare platform. In terms of value proposition, for citizens, MySejahtera provides one person, one record, access to lifetime health data. For the government, it offers real-time big data to support evidence based on the policy making. For healthcare providers, it streamlines patient flows and reduces administrative burden. Furthermore, MySejahtera maintains customer relationship through a self-service mobile app, automated notification, and trust-based data security. The main customer segments include all Malaysian citizens and residents, public and private healthcare providers, pilgrims, and high-risk groups such as elderly and the chronic patients. Finally, the key resources include the National Data Health Base, a large registered user base, secure cloud infrastructure, and integrated medical APIs. The cost structure covers system maintenance, research and development, cybersecurity, and staff training. While MySejahtera is only focused on a social value, future revenue stream may include premium telehealth services and long-term cost savings through early disease detection.
Now, I will continue with the gap analysis. Firstly, when evaluating the current and future state of MySejahtera, the system is currently effective as a digital health monitoring and record-keeping platform. It performs well in vaccination tracking, health reporting, and public health communication. However, the future vision is to move beyond basic digitalization toward a data-driven and predictive healthcare system. In the future, MySejahtera can leverage advanced data analytics and artificial intelligence to forecast health risks, identify early warning signs, and support preventive healthcare strategies. This will allow MOH to shift from a reactive approach to a more proactive and preventive health management model, improving national healthcare outcomes. Next, in terms of work effectiveness, MySejahtera significantly improved operational efficiency within the healthcare system. By digitizing health records and automating processes, the system reduced manual data entry, minimized errors, and speed up information sharing. Healthcare providers can access updated information quickly, enabling faster and more informed decision-making. This clearly shows that the system facilitates work effectiveness across different levels of healthcare administration. Moving on to who benefits from digital transformation, MySejahtera provides value to multiple stakeholders. The public benefits from easier access to personal health information and reminders, encouraging preventive care. Healthcare providers benefit from streamlined workflows and improved data access. Policymakers and administrators benefit from accurate, real-time data that support planning, monitoring, and policy formulation. Collectively, digital transformation enhances coordination across the healthcare ecosystem. However, several gaps and weaknesses remain. One major limitation is dependence on reliable internet connectivity, which affect users in rural and underserved areas. There is also a digital divide where some users lack the necessary digital skills to fully utilize the platform. In addition, while MySejahtera collects large volumes of data, its analytical capabilities are still developing, limiting deeper insights. Another critical concern relates to data privacy and security, as the platform stores sensitive health information. Strong data governance, transparency, and security measures are essential to maintain public trust. Any weaknesses in the area could affect user confidence and system adoption. In summary, the gap analysis highlights that while MySejahtera is effective in its current role, continuous improvement in technology, people, and skills are necessary. By addressing these gaps, the Ministry of Health can ensure that MySejahtera evolves into a more intelligent, inclusive, and future-ready digital health platform. In conclusion, MySejahtera plays an important role as a digital health platform that supports the Ministry of Health in managing public health services more efficiently. Beyond its initial use, the system has evolved into a tool that centralizes health information, improves access to health services, and supports better coordination within the healthcare system. By digitizing health records and automating key processes, MySejahtera enhances work effectiveness, reduces manual administrative tasks, and supports data-driven decision-making. Moving forward, continuous improvement in system design, data management, and digital capabilities will allow MySejahtera to better support long-term healthcare planning. With strong governance from the Ministry of Health and ongoing technical support from the MySejahtera development team, the platform has the potential to become a more integrated and sustainable digital health solution. Overall, MySejahtera demonstrates how digital transformation can strengthen the public healthcare system by improving efficiency, accessibility, and service quality for the benefit of both healthcare providers and the public. Thank you.